Hi everyone, it's Nancy Tran, registered dental hygienist and Burst Senior Ambassador. Today's segment on Burst TV, I wanted to talk about tooth eruption and remedies that you can use at home to help treat your child's discomfort. Tooth eruption occurs anywhere between 6 months all the way up to 33 months, which is about 3 years old. It's important for us to understand the eruption timelines because more than likely you're going to experience this with every kid that you encounter. The beauty of tooth eruption is that most kids are already born with 20 tooth buds below the gum line, and it's always characterized by different months and timelines that you can expect these teeth to come in. Teeth exfoliate and they come in on certain time periods, and it's great for us to understand these because we can alleviate these symptoms. Being able to recognize early signs and symptoms of primary tooth eruption opposed to permanent tooth eruption is important because kids at that age aren't able to communicate with us what's bothering them. They also have a lower pain threshold as well. So what are some of the signs and symptoms of tooth eruption and teething? So it starts off with increased irritability and fuzziness, loss of appetite or sleep, restlessness, inflammation or redness, soreness in the gums, increased saliva flow or drooling, and the dire need of wanting to put everything in their mouth and chewing and biting on things. And sometimes, not always, can be followed by a low-grade fever. And this is what you've all been waiting for. What remedies can we do to help treat our little patients when they are teething and having discomfort? There's many remedies out there, but what's worked for me and what I've told my patients is simple. We try to do the natural remedies first, and by all means, we want to do any medications or over-the-counter as our last resort. You can massage the gums with clean fingers or a damp, cool cloth. I like to dip mine in ice cold water, or if you have a washcloth that's textured, you can wet it and put it in the freezer so the baby can actually chew on it. That'll help break the teeth from underneath the gums. You can also do silicone BPA-free teething necklaces. There's also theory that amber necklaces can help alleviate some of that pain and discomfort as well, but it hasn't been proven. It's just preference, I guess. And then also a lot of times it's just TLC, tender loving and caring, massaging those gums, making sure that the baby is eating soft foods. They can bite into textured food that they're comfortable with. That's going to help break the gums a lot quicker. Both of my kids, on the other hand, were a little different. They love to eat. So anytime they had the opportunity to eat frozen fruit, sugar-free popsicles, or even Pedialyte. Pedialyte saved us because they both had a loss of appetite when it came to eating nutritious foods. So Pedialyte helped keep them hydrated, made sure that they got all the nutrients that they needed, and then also it was cold to the touch, so it helps soothe the itchy and the swelling in the gums, and they loved having 1 or 2 popsicles a day to help with their symptoms. And then of course, last but not least, if all fails, you have Tylenol that's over the counter, and then there's also topical oral gels as well. Those include benzocaine, so it's not recommended for any kid or child under the age of 2 to take anything with benzocaine on there. Hopefully this segment has provided some guidance and some tips and remedies to help with any future issues or problems that you might have with little ones teething, or also for dental professionals recommending it to your patients. You can stay tuned for future segments. If you haven't already, please subscribe down below for future Burst TV segments. Thank you so much and have a great day. Bye y'all. Tooth eruption occurs anywhere between 6 months all the way up to 33 months, which is approximately 3 years old. It's very important that we understand these eruption timelines because more than likely you're going to experience the same eruption patterns with all the kids that you have.